Personally, I believe that artificial intelligence is important, but to come to the conclusion of that disease and what and how it is human intervention will be very vital for the same. As far as concern of confidence, which in the patients also, we have to, if we are changing a service provider side, the patient means the service taker side also to be changed accordingly. So they should be confident on the. So currently we are in when we will be moving to the transition phase when the doctors are also not comfortable with artificial intelligence. If you say like that, okay, these data are saying your practices, your geographical area, your age, your gender differentiation, your soil related, your pollutant level, this all coming together, and now there is a probability of having COPDs, or I'm hypothetically giving example, 75%.
We are talking multiple things. So one is we need to first be clear on where AI can be a solution and where AI is not sufficient. So say for example, like Doctor just mentioned, that AI will never be able to replace human beings. It is a subjective profession. Healthcare is a very, it's a very significant profession. We're dealing with lives of people. We cannot just rely on AI for everything. So, or for most of the things in fact. I think where AI plays a role is something which is very mundane, something which is very, go by the book kind of a thing. Where there's a differential diagnosis or where we're doing in radiopath, we can do that. But overall, when it comes to, say for example, if you need to get a biopsy done, an AI can say that, depending on, what your radiograph is talking about, what kind of MRI scans you had. AI can definitely guide you there, whether you need or not. But eventually, when it comes to treatment, I think doctor would not be able to, doctors cannot be replaced. Similarly, when you talk about robotic surgeries, some places, robotic surgeries can be helpful, but not overall. So it is kind of a differential thing which we need to figure out where AI is an enabler and where AI is absolutely having no role. I think that's the kind of differentiation which needs to happen.
First of all, the comparison itself between AI as a replacement to doctors itself might be wrong to do. Yeah, if we project the concept itself in that way, then itself will hinder us to implement it. So we have to understand because the medical field itself has changed a lot over a period of time. Yeah, just that it's some way you can feel like some third person who is not into the medical fraternity is giving you and suggesting you something. So there will be definitely that challenge to convince them in terms of the value addition what this AI will do. Yeah, but there are multiple programs where there has been a participative efforts by universities in US also, in India also recently started games, that they have certain programs where they jointly do a educational program, training program through AI, because certain scenarios in healthcare you can't create it, because you have to the emergency room, like you have to do it practically, then only you can address it. But AI definitely can help you in creating that scenario in real life. Everything can be managed, multiple scenarios can be accommodated and performance can be evaluated. So we need to justify where AI can value add instead of putting it across like it will replace something, it will replace something. I think it's a needless question to raise now.
I think we have to keep in mind that we are in India where there is a huge shortage of doctors. And while AI cannot replace doctors, but when doctors are not available, AI can be a tremendously good guide. If a person having chest pain at night is guided on the fact that you need to rush to a hospital early on, the life will be saved. And so I think AI can be extremely assistive in a country like India. And I think if doctors are open to that, to the fact that they will get patients who have been already trained by Dr. Google to ask some difficult questions, I think and if they are patiently sort of hear that out and say, no, that this is not your problem, I think that would be a great thing in our country. So I think that perspective also has to be kept in mind.
Absolutely, AI can be helpful, or telemedicine can be helpful when we're reaching out to remote people where we can save life in terms of a chest pain happening and giving them certain quick tips and getting them to the hospital very quickly, or a robot can help them, okay, do this, just to save time and then take them to the hospital. But overall, I think we need to think about AI as an enabler to help doctors achieve more efficiency and better outcomes.
For more updates from CXOTV, please like and subscribe to our channel.